Our PCPs, believe it or not, spend about 9 to 12 months training and learning to lead teams, influence patients, master customer service, understand medical economics, differentiate documentation and care for outcomes versus for billing and more. And we actually train our doctors differently. We don't joke anymore. We actually tell them seriously, well, doctor, when you join, it's a 1-year fellowship. Do not think of this as you're an attending. You are a well-paid fellowship, right? And we put them through this training. And let me tell you the 3 things that we focus very deeply on, and which we think we are helping to forward the field of medicine and training in. So 3 areas. Number 1, we train doctors to think holistically. Historically, PCPs have solved problems through pills, procedures, and referrals. We have learned that about 20% of a true patient's health it involves pills, procedures, and referrals, what we learn in training. The other 80% of the equation is moving most of these patients upstream to focus on things that, for example, are lifestyles and behavior, social determinants of care. And of course, we have not yet figured out a way to modify genetics yet, but maybe one day. And so as doctors, as we think holistically and train doctors to think holistically, that is something that we must sort of develop in our physicians. Second of all, we train our doctors to focus on prevention. I'm a doc. I finished my training at a Harvard hospital, and then I went to Cornell and felt very good about myself. Came to South Florida with the equivalent of 5 board certifications. But what was crazy was my very first patient was a heart failure patient. And I said, well, I got this. And that patient got readmitted and died. And so I discovered very quickly that I did not know, that doctors do not know, they are not trained in prevention. For something as simple as heart failure, which I'm probably, at the time, was one of the highest trained cardiologists in the state at the time, who did not know how to prevent what, quite frankly, is one of the most preventable and leading causes of admission in America today. We believe today that 90% of heart failure admissions are preventable. Talk to any emergency room doctor. They'll give you the similar number, 80 to 90%. And we demonstrated that, particularly in patients with multiple chronic conditions. So we are training doctors to move upstream. We are creating workflows that do not exist. We have evidence, we have data that surpasses many of the academic institutions that I've worked at, because we are so broadly distributed and because we have access to the full source of all the data sets to create these workflows in prevention. And third, we train doctors how to win. What I discovered is that doctors, during our training process, we're not taught to be accountable for outcomes. We're altruistic people that are mission driven. It's a calling. But yet we aren't taught how to win. We are taught, and we come in wanting to win, but not taught how to win. And the only way that you know if you're winning or not is you have to measure it. So we actually make our PCPs accountable for an outcome. We expect our PCPs to reduce hospitalizations by 50%. It is not enough to try. We do not give out trophies for trying. We are unique in that we give trophies for winning. And therefore, we believe that we, our doctors, are accountable for improving the patient's health outcome across the spectrum, because you cannot improve what you do not measure. And so we measure everything. Where you have folks with several analytics people. In our organization, we have well over 300, it would be close to 400 data scientists and software engineers in our organization that's partnered with us. And so we take our tech and we take our analytics very, very seriously.
Hey, Dr. Faisal Syed here. Did you like this video? Be sure to subscribe to our channel by clicking here. And you might like these other videos. Click up here to watch more.